If nothing else, the COVID-19 emergency proves that some people are hurt more than others. That's why a coalition of advocacy groups wants to make sure that as the state moves toward recovery, no one's left behind. To tell us about that effort is a member of the Massachusetts COVID-19 Response Coalition and the executive director of Community Labor United, Lee Matsueda. Thank you very much for being with us, Lee.
Hey, thank you, Chris, for having me.
Lee, flesh this out a little bit. Tell us about the populations that are represented by these advocacy groups.
Yeah, for sure. I mean, let me just start by saying, I know these are really scary times, and more than ever, I think the effects of what's going on around COVID-19 reinforce the notion that we depend on each other, right? And so, no matter our background, where we come from, what we look like, even the amount of money we have, I think it's time that we're figuring out ways to come together, work together. And so that's what this coalition has been about. It's about bringing together really the work of many different groups and organizations and coalitions that are speaking to the needs of working people, the needs of frontline workers and communities of color. But I would just say that as much as we're trying to elevate that, this is about how our whole society, how we in the Commonwealth and in the city make it out of this in a way that really lifts us all up. And this is about all of our safety. And clearly, though, we have a specific set of our population that is really vulnerable to what's going on with COVID right now, because maybe they are frontline workers that have to be out there, whether they're cleaning, whether they're operating our transit systems, whether they're the healthcare workers on the front lines or in those grocery stores. So, I think a lot of the folks that we're bringing to the table are really concerned about those issues that represent in their membership, have those folks in their organizations or part of their coalitions. And so our effort has really been to bring together a really broad set of response and needed recovery efforts. And we start to articulate that through what policies we need to move at multiple levels.
On one hand, this is one more coalition with one more list of things needed or wanted. But on the other hand, the message here is about structure, isn't it?
Yeah, I mean, I think that's a really important one to note. I mean, the pandemic has really revealed and continues to reveal the stark inequities, right, in our communities and in our systems. Places like Chelsea, Lawrence, Revere, they have the highest rates of infection right now. Dorchester, we know, is experiencing that right now here in Boston.
And Hyde Park, too, I think.
Yeah, Hyde Park, exactly. And so taking concrete action to a sort of advance a just response and recovery for all most vulnerable people in our communities, I think that's really important. And that means addressing not just immediate needs, but also addressing longer term structural changes, because we have people who are elders, who are dealing with respiratory illness, and frontline workers. These issues that they face are not specifically new. They're just being really amplified in a moment where you can't turn away. You have to look at that.
Well, you have some concerns down the line for recovery, but you also have some immediate concerns about access to information, whether it's about people who need care or about finding data breakdowns. Why are those so important?
Yeah, I mean, we're working really closely with a set of folks who are public health experts and, who are part of one of those other coalitions that are really trying to take the lead on the connection between health and housing. And this is a set of things that have really come up from our conversations directly with them, that right now, and we see this in other parts of the country, how we track who's getting, the care, who's actually contracting the rates, and that's now starting to be released. Although those data, it's clear that data is insufficient. I think the mayor here in Boston has said it's limited, right? That data, and so feel that it's really important that as we're responding, we're doing our best to track it and make sure that we learn from this and that we understand who's really being impacted. And I know that it's a bigger issue than just tracking. It's about testing too and making that widely available. And I think our hopes is that we're just remembering that this is not the only time something like this is going to hit, that we have to take some lessons from this. And it seems really important to understand who's affected, who's impacted disproportionately, and then to make sure that we act accordingly.
Well, just looking at the map, here in Boston, we see the higher rates of infections, especially along the Fairmount corridor.
Right.
It almost coincides where I've seen higher rates of eviction notices not so long ago. And you're concerned about that too, aren't you?
Of course. I mean, we've been encouraged because, these are unique times. I think people are risking their lives, healthcare, public transportation, all these other services we depend on. There's been great response in the communities, funds for undocumented workers, mutual aid networks. Legislators, though, speaking to your issue around housing, are actually trying to work with a set of advocates right now, and they've started to advance a piece of legislation that would actually put a moratorium on evictions. And that is encouraging. And there is a way to go. That's not finished. The governor has to sign it. It has to come out of a sort of conference committee. And I think it is in part why we exist as a broader coalition, because we feel like you got to check these things off, but there's so much more that we have to do.
Looking down the line, a lot of people is talking about this kind of a slow, phased-in recovery, and maybe slower for people in certain sectors. It could be the food sector, hospitality sector. You're going to have service workers who might have to take the T to go to work. They can't stay home and work from a desk. What about that kind of a divide?
Yeah, I mean, it's hard to really imagine what a recovery looks like coming out of this, in that, just people's reaction to how you use public transit. I typically depend on it basically every day. And I think for those who don't have a choice, they're on it right now. They're on the system. They're using it to get to their basic services and needs. But I just mentioned that because we look at what that recovery actually takes. And I think so many issues are going to have to be addressed at so many levels. And I think this is the time where we can't talk about, just severe budget cuts. Look at all this, it looks like we're going to need just so much more significant investment that's going to come from the federal government. And that's going to come from us as a state looking at, where else can we find resources? We look at, as an example, one of the major concerns that I think we have around resources is, let's make sure we're not funneling those off to others, like businesses, big business. Make sure that people really in need, these frontline communities, are first in line for those resources. And we're just concerned because we know that in these moments, there's opportunity that arises, not just to address the long-term systematic issues, but to also give some of those resources back to big companies and big business in the region. And concerned about that. They have a role to play here. And I think that role could actually be really supporting the recovery efforts by making sure that those resources are really going to those in need. And I know we're not at a place of talking about more revenues, but what we could do is, for example, close some of the loopholes that are allowing big business to get away with some tax breaks that I think right now we can't afford.
Well, in an ideal world, we would quickly have universal testing with no false negatives. But what do you think the coalition has to do to get at least the best possible deal as far as that?
Yeah, no, it's a really good question. I mean, I think on our front, what we're starting to do is say, listen, there is very much a needed policy response, let's say at the state level for starters, that really speaks to multiple issues. And that's why we've talked about this sort of checklist of, there's 17, we probably could be adding to it with the new groups that are engaging with our effort. And so that's a starting point that says, here are the key things that we have to address as a Commonwealth and as a region. But I don't think it ends there. I think because things are operating the way they are, I think legislators, leaders, other elected officials really need to work in collaboration with advocacy groups and other community efforts to actually implement some things. And so these are not just big ideas. These are actually things that we think can be implemented now. And so there's going to have to be efforts at probably municipal levels as well, where we're actually starting to work really closely with government officials and leaders to say, here's what it looks like for us to put a policy in place that makes sure we have really strong protections for workers and access to healthcare for everyone and protective equipment as needed. And all these things, right, that are not just about the here and now, but go beyond that. So I think how policy plays out will not just be at the state level, but that is one place where there's an opportunity, because there's, over 90 bills or something at the State House right now around COVID-19. And I think what we need to continue to show is that there's an urgency to respond on multiple issues. And the piecemeal effort is one approach, but I think we're looking for a more comprehensive set of solutions.
Before the virus hit us, we were a country that was sharply divided around unauthorized immigrants, and which left a lot of people in the shadows. What do you see now and going ahead?
Well, when I think about, they're in my heart because I think a lot about who is really struggling in this moment. And I do think of some of the undocumented populations that are actually really, key workforce to our region, right? And I feel like that story is somewhat being told, but the solutions to address their needs are missing and are not really there. And that is really disturbing. When I hear stories in Chelsea of people waiting in the rain in lines at a community organization to get food, right? We're hearing this from an amazing organization called the Chelsea Collaborative. And when we hear that playing out, and it's for reasons that have everything to do with, listen, this is a trusted organization in our community that we can go to, and with our documentation, being undocumented, that feels really important to have someone you can look to and trust. And right now, I don't think the government is necessarily that place, right? Our local and state governments are not that place to address those needs. And so that's really unfortunate. It's scary. And that's why these funds are really important. That's why these mutual aid networks are really important. That's why community organizations like the Chelsea Collaborative are critical, because not everything can be addressed through state legislation right now, or even municipal policies and laws. So I think there are efforts that could be done, but in the short term, folks are scrambling to rapidly respond to the needs of communities like that. And I think there are ways that community people who care about, making sure we all make it through this can give to those mutual aid networks and undocumented funds.
Yeah, I want to ask you about one other thing. You've been sort of a transportation and environmental advocate for a number of years. It was only 6 weeks ago that you wrote an op-ed saying that we really got to think seriously about the low-income fares to provide more access to the MBTA. Given the budget problems facing the T, does that have to be pushed down the road now?
Obviously, we're in contact directly with the workers that are operating our systems. We give so much thanks and appreciation to them because they're just out there really risking themselves, and like everyone else, are really scared about what's going on and want proper protections and policies in place. And so in those conversations, though, I think I mentioned that because there are a set of needs both for the health and safety of workers and riders that have to be paramount in this moment. And so that's what we're talking about. How do you make sure workers get the gear they need, that they're getting properly tested, and that the system has what it needs to continue to operate in this moment, right? And so that's a first thing. I think we definitely think about, as we come out of this, what does it look like for us to have access, right? And for people to feel safe and confident in our public transit systems. And that does mean making sure our cleaners are well supported and have what they need to maintain the system and keep it clean and safe. That means that all the folks that are using it are also going to be really struggling at that point. And I think we really appreciate the MBTA acknowledging that and saying, listen, we're going to do rear door boarding. I know other transit agencies across the state are also doing this, where it's essentially a free bus system. And what we see about that is how the system operates. And I think those are the things that we'll be coming back to. But in this moment, it feels like there's a whole nother suite of issues that we need to address. I am also, we're going to continue to talk about what it looks like to have fully funded transportation systems, education systems, housing, right? All these critical needs that are really being exposed in this moment. I think those are not going anywhere. And so we're going to continue to talk about, as I said before, how do we have progressive dollars that go towards those efforts, and making sure that big business is doing their fair share and paying their fair share towards those systems. These are public goods that we have to continue to invest in.